My name is David Westbrook, and I'm Senior Vice President for Strategy and Innovation here at Children's Mercy. We are a pediatric destination healthcare system that takes care of more than 600,000 patient encounters in 1 year, with a budget of $1.3 billion and nearly 8,000 employees, 600 of which are medical doctors, most of whom are medical subspecialists. Our work is not only treating rare diseases that we see frequently enough to be really good at it, but taking care of a population's health. And we're increasingly concerned with taking initiatives and forming alliances and partnerships that will enable us to influence a better health for a better community. And my job is really to do the analysis and design some of the strategies and hopefully bring together some of the groups that need to be brought together so that each child we take care of, whether well or ill, can achieve their fullest potential for good health. You know, we're a children's hospital, but there's a statistic that I think is staggering. 62% of the people who are in hospitals that take care of adults today are there because they have lifestyle decisions they've made that have taken them to the hospital. So the management of the population's health is going to be the critical issue for healthcare in the future. We take responsibility not just for taking care of kids who are sick, but increasingly taking care of conditions that will lead to children becoming healthier and healthier. We want our kids to achieve their greatest potential for good health. That's what we stand for. And that doesn't get achieved as a mission if we only take care of kids who are sick. So we have to be a leader in convening relationships and in causing things to happen that lead to better health for more and more kids. There's an author who wrote his novels primarily for other authors, I think. His name was James Joyce. Every English major in college deigns the day that they had to read their first Joyce novel. But he said something one time that I think really is relevant to technology. James Joyce said, "We shape our tools, and thereafter our tools shape us." And the technologies we have today are so sophisticated, are so dynamic in the way they are able to give us instant analysis of what it used to take weeks, months, even years to figure out. That analysis is giving us a chance not just to conduct remarkable research, but to perform remarkable diagnosis that leads to remarkable treatment of patients on a daily basis. Those tools are going to get sharper and sharper. They're going to become more accessible to people not only in the hospital or the clinic, but at home. And they're going to make the practice of medicine better, people healthier, and expenses go down. Well, our big world is getting increasingly smaller, and that is because of the communications and computer technology that are available to every common man and common woman increasingly across the globe. So we'll do consultation with someone in Germany or someone in China and give a reading of an X-ray that seems to be presenting peculiar circumstances that may be common to us because we have experts here who have seen this condition again and again. And some of our diagnosticians in radiology actually are working all night so they can take care of patients on the other side of the globe whose doctors are seeing them during the day. That is not going to become a primary focus for our hospital in the future, but when we have global expertise, we're going to be called on by people across the globe to exercise that expertise. And if they have a capacity to pay, because they're outside our region, we have a capacity to listen and be of service. That helps us get better and better and helps people across the globe get better and better. I have two concerns for the future of the healthcare industry. I think that we are challenged by politics. There are people who would put healthcare at the center of a political agenda. And because of being put at the center of a political agenda, we become a controversial institution. I think we have a pretty good handle on what the incentives are going to be in the future. We've got to do more with less. We have to reduce costs and improve outcomes. We know that's the mandate. There are sometimes political crossfires that we get in the middle of that can be distracting to the primary mission that we have to have to deal with. I think the other issue for us is really, will we as an industry be nimble enough to change fast enough to give the customer, the patient, the payer, what they really need? I think there will be some institutions in the future that just won't adapt to the future. They won't even know they're in, and they'll fail. And I suppose to the extent that failure leads to consolidation, and consolidation creates efficiencies and better outcomes, that's okay. It's an awfully expensive and disruptive way to get there, and somebody has to pay for that. So those are the two things that I think right now keep me awake at night. We're going to see the increasing impact of genomic medicine. 20 years ago, it would take $1.2 billion and 20 years to define a human genome. The code was broken on that by Francis Collins, who is today the director of the National Institutes of Health. Here at Children's Mercy, we can crack the code on a patient's genome in 48 hours for less than $10,000. And that gives us an opportunity to look at diagnostic dilemmas that are otherwise challenging and sometimes insoluble, and solve a problem for a patient so that they can get the treatment they need before the disease that's rare deteriorates their body beyond recovery. That's going to be an increasing trend in the future. The genome, the computer, the harvesting of big data, all of that will come together at an intersection called healthcare, and it's going to make a huge difference in the amount of money we spend on healthcare and the better outcomes we're going to deliver.